Now we are moving to cell injury. In cell injury, first one is apoptosis. What is in apoptosis? First one is programmed cell death. Then we all know that what is programmed cell death. In this, 4 basic points to understand the definition. First one is pathway of cell death, where the cells are killing their own cells, that is committing suicide. Then next one is programmed cell death. Then next one is activating certain enzymes which causes destruction of DNA and different nuclear and cytoplasmic proteins. The next one is cell membrane became intact. These are the 4 basic points to understand the definition. Then what is apoptosis? Apoptosis can be defined as a pathway of cell death induced by a tightly regulated intracellular program in which the cell destined to die activate enzymes that degrade cells or nuclear DNA and nuclear cytoplasmic protein. That's we all this studies in UG level itself. Okay. The word, what is the word apoptosis mainly in Greek usage? It means dropping off or falling off, or petals from flowers or leaves from trees. These are the apoptosis means what? Dropping off or falling off petals from flowers or leaves from trees. That is means of apoptosis. The apoptosis means it's a Greek word. Then what is apoptosis in physiologic condition? First one is programmed destruction of cells during embryogenesis, including implantation, organogenesis, developmental involution, and metamorphosis. Example and what are the examples? Separation of webbed fingers and toes in embryo. Separation of webbed fingers and toes in embryo. These are the example. These are the pictures show that webbed fingers are separated from a classic example of apoptosis means integration. That means so-and-so's death during digit formation of human embryo. That means first in picture there's the red region is cell death and visible tissues. These are the picture shows. Okay. Then next one is hormone dependent apoptosis. Example, endometrial cell breakdown during menstrual cycle. Then next example is ovarian follicular atresia in menopause. Third one is regression of the lactating breast after weaning. These are the next hormone dependent apoptosis. Then next third one is death of host cell that have served their useful purpose. Example, neutrophils in an acute inflammatory response, that is lymphocytes at the end of an immune response. In this situation, cells undergo apoptosis because they are deprived of necessary survival signals such as growth factors. Some growth factors will affect this cell death. Okay, then what is the role of disease in apoptosis? In this, radiation and chemical used in cancer therapy induce apoptosis in some types of cancer cells. This one, the radiation and chemical used in cancer therapy. Okay, right. Then necrosis. Then in this, necrosis will what will happen? The normal cells, apoptosis will formation of blooding. Then this will lead to the cells breaks apart into several apoptotic bodies, which are then phagocytized. There is no inflammation will occur. Then in necrosis, apoptosis will happen. This non-inflammation, but in necrosis, cells will swell and plasma membrane rupture. Cellular and nuclear lysis will causes inflammation. So apoptosis will never will happen the inflammation, and necrosis will lead to inflammation. Okay, then what are the morphology of apoptosis? First one is cell shrinkage. Then next one is organelle reduction. Then next one is mitochondrial leakage. Then next one, chromatin concentration. Then next one is nuclear fragmentation. Then next sixth one is membrane blubbing and formation of apoptotic bodies. These are the 6 major morphologic changes will happen in apoptosis. This is the picture will show these changes. Cell begin apoptosis, then formation of blubbing, then nucleus in formation of blubbing, nucleus is condensing and blubs, then apoptosis bodies is ruptured, then parts. These are the picture will clearly mention these morphologic changes. Then next one is mechanism of apoptosis. In this, 2 phases of apoptosis are there. First one is initiation phase and this next one is excitation phase. In initiation phase, activation of enzymes, that is FasL. Then in this 2 pathways are there, intrinsic or mitochondrial pathway and extrinsic or receptor mediator pathway. These are the 2 pathways which will under the initiation phase. Then in execution phase, enzymes causes degradation of cells. Okay. Then first one is initiation phase. There is 2 pathways are there, intrinsic or mitochondrial pathway and extrinsic or receptor mediator pathways. These are comes under initiation phase. First one is extrinsic pathway of apoptosis. This is receptor mediated programmed cell death pathway. That is extrinsic pathway of apoptosis or receptor mediated programmed cell death pathway. In this, extrinsic pathway is otherwise called a death receptor pathway. It is mediated by death receptor or plasma membrane. It is mediated where? Death receptors on plasma membrane. Then, its component. What are the components? First component is death receptors. Then next one is death ligands. Then adaptor protein. Then caspase. Then the extrinsic signaling pathway leading to apoptosis involves transmembrane death receptors that are membrane of the tumor necrosis factor. That is TNF receptor gene family. Which is TNF. That is TNF is tumor necrosis factor, which comes under receptor gene family. In this, 2 types of death receptors are there. That is first one is TNFr. That is tumor necrosis factor receptor and FasR, fatty acid synthase receptor. That is, these are the 2 types of death receptors are there, TNFr and FasR. Then the ligand for Fa is called FasL. The ligand for TNFr is called TNFr gamma. Then binding of the complementary death activator FasL and TNF respectively, which transmit a signal to the cytoplasm. This FasL and TNF are mainly the signal transmit the signals to where? Signals to cytoplasm. Then FasL will binds with the FAS receptor. TNF gamma will binds with the TNFR. When 3 or more FasR receptor gets cross-linked with the FasL, they will form a binding site or adoptor molecule, which will form as a binding site or adoptor molecule. Then adoptor molecule has a death domain known as FAD. FAD means what? Fast associated death domain. Fast associated death domain and a TRADD. TRADD means TNF receptor associated death domain. That is TRADD. This activates the inactive form of caspase. Then also the process are 8 to caspase 8. These are the main risks. Then next one is apoptosis triggered by external signals. Some cells are in external signals. Here what are they? The extrinsic or death receptor pathway. These are the diagrammatic representation is. I will show this in this figure. First one is apoptosis, then caspase activation, then activation of caspase 8. Then next one is binding of the complementary death activator. and receptor transmits a single signals to cytoplasm. Then FAS and TNFr receptor are integrational membrane proteins with their receptor domains exposed at the surface of the cells. These are this is the another diagrammatic representation which will clearly mention. I will already explain this picture. Okay, this is also extrinsic pathway of the apoptosis. These are the extrinsic pathway of apoptosis. These are the extrinsic. Then next one we will discuss about intrinsic pathway of apoptosis. In this, mitochondria mediated programmed cell death pathways. This is the intrinsic pathway of apoptosis. That is mitochondria mediated programmed cell death pathway. Okay. In intrinsic signaling pathway for programmed cell death involves non-receptor mediated intracellular signals inducing activities in the mitochondria that initiate apoptosis, which stimulate for the intrinsic pathway include viral infections or damage to the cell by toxins, free radicals or radiation. Also, damage to the cellular DNA can also induce the activation of the intrinsic pathway for programmed cell death. Okay. Then, what are the components for intrinsic cell death? The first one is BCL2 family proteins, then cytochrome C, apoptosis, then caspase. Then, next one is BCL2 family protein. BCL2 family protein, the control and regulation of apoptotic mitochondrial events occurs through membranes of the BCL2 family of protein. Also, anti-apoptotic proteins include BCL2, BCLH, and BCLHL. Okay, then also pro-apoptotic proteins include BHH, BAK, BAD, BAD. Then the main mechanism of the action of the BCL2 family of proteins is the regulation of cytochrome C released from the mitochondria via alternation of mitochondrial membrane and permeability. These are the main regulation of cytochrome C, main mechanism of action of the BCL2 family proteins. Okay. Then next one is lack of growth of signals or survival signal. That is pro-apoptotic proteins are activated, which increases the mitochondrial permeability. Also, because of this, there is a release of cytochrome C from mitochondria to cytosol occurs. Also, cytochrome C binds and activates April, and then which will happen apoptosis activating factor 1 as well as pro-caspase 9 forming an apoptosis. Also, CASP9 form the pro-caspase 9. Okay, this is like a clear-cut picture about intrinsic pathway apoptosis. Then, in inhibition of apoptosis will happen. Then first one is what? Inhibition of anti-apoptosis factors, which will lead to activation of pro-apoptosis factors. That is BATS. Then BATS reacts the pores on the mitochondrial membrane, which will happen when cytochrome C will happen. Then release of cytochrome C. Then release of cytochrome C. Apoptosis. Then after this cytosol, then 9 will form. Then after that, pro-caspase. Then after that, last will apoptosis will lead to this condition. Okay. Then next one is execution phase. This one is execution phase. Execution phase means final phase of apoptosis is called execution phase, which is mediated by proteolysis yesterday after initiator caspase are cleared to generate its activated form. The enzymatic death program is set in motion by rapid sequential activation of the executor caspase. Then caspase 3 activates DNase, which causes degradation of chromosomal DNA within the nuclei and causes chromatin condensation. Then caspase 3 includes cytoskeletal recognition and disintegration of cell into apoptotic bodies. This is the execution phase of apoptosis. Sorry. This is the execution phase of apoptosis, mitochondrial pathway. Then these are the diagrammatic representation. This is also another diagrammatic representation. Cell chromatin condensation, membrane bleeding, nuclear collapse, then apoptotic body formation. Okay, these are the apoptosis chapter. So, study well. Okay, all the best. Thank you.